with compassion and empathy, leading to the best health outcomes. In light of the transition from the National Hospital Insurance Fund to the Social Health Authority, it is imperative to address the disruptions in cancer and communicable diseases services that will threaten to compromise personalized care for patients across Kenya. We therefore take this occasion to highlight the pressing concerns affecting cancer patients and demand immediate intervention from the government and relevant authorities. We urgently call on the government of Kenya and the social
forced to seek costly private alternatives with a single dose of Herceptin priced at an average of Kenya shillings 100,000, which is only 3 cycles under the current coverage limits under SHA. There is also a dire lack of essential drugs, including chemotherapy drugs such as pertuzumab and hormonal drugs such as letrozole, affecting thousands of patients. This is totally unacceptable and must be addressed immediately. Number 2, denial of cancer and NCD services. Many cancer and NCD patients have been denied care or forced to pay out of pocket for services previously covered under SHA. Despite government assurances of a seamless transition, numerous patients report being turned away from treatment centers, creating unnecessary financial and economic burdens. And we have heard that even from the survivors who shared here. Number 3, unclear SHA oncology and NCD coverage. There is a widespread lack of information on what SHA covers, leaving patients in
is also get affected or they are vulnerable to the same. Second question is, yes, HPV vaccine is safe. We'd like to know, however, what's the survival rate of the children?
When they started their HPV vaccination program, and our sister Uganda. Actually, Kenya is a late entry into the HPV vaccination agenda in our region. So even before we go to countries like Australia and Switzerland, which are now at 0 cervical cancer cases, there is already studies that are showing, demonstrating evidence that the HPV vaccination works. Yes. The other question was yes. All of us. First of all, no. All of us, whether we have any condition compromising our immunity, we should be screened. But we are saying when you have a condition that compromises your immunity whatsoever, it puts you at a higher risk. Because when the HPV vaccine gets into your body, then it has an opportunity, because your immunity is not strong to fight it off. Then it has an opportunity to be passive. If he loves his daughter, he protects her future by taking her for vaccination. Tell that man. Final thought: cervical cancer is preventable. If we all joined hands and we said, let everybody get vaccinated, let every girl, by the time they are celebrating their 15th birthday, they have received cervical, they have received HPV vaccination, and let every other woman be screened. Can it be a promise for this Valentine? Yes. That all the women, instead of the roses they are going to receive, you will escort them with a specular. And with that, I say thank you very much. They are not allowing girls to take the vaccine. And they are saying they are waiting for the fathers, because it is new vaccine, just in case the girls develop complications.
In light of the transition from the National Hospital Insurance Fund to the Social Health Authority, it is imperative to address the disruptions in cancer and communicable diseases services that will threaten to compromise personalized care for patients across Kenya. We therefore take this occasion to highlight the pressing concerns affecting cancer patients and demand immediate intervention from the government and relevant authorities. We urgently call on the government of Kenya and the Social Health Authority to take immediate and decisive action to protect and ensure the continuity of cancer and NCD services. The transition from National Hospital Insurance Fund to Social Health Assurance resulted in several disruptions, jeopardizing the lives and well-being of thousands of Kenyans who depend on uninterrupted medical care.
The SHA. Number one, the shortage of life-saving cancer medication, Herceptin, and other essential drugs. Breast cancer remains a leading cause of cancer-related deaths in Kenya, with over 7,000 new cases and 3,400 deaths annually. Approximately 25.6% of these cases are HER2 positive, requiring the essential drug Herceptin into brackets trastuzumab. However, since the transition to SHA, patients in public hospitals such as Kenyatta National Hospital and Kenyatta University Teaching and Referral Hospital, they have faced dire shortages of these life-saving drugs. Patients are being turned away or forced to seek costly private alternatives with a single dose of Herceptin priced at an average of Kenya shillings 100,000, which is only 3 cycles under the current coverage limits under SHA. There is also a dire lack of essential drugs, including chemotherapy drugs such as trastuzumab and hormonal drugs such as letrozole, affecting thousands of patients. This is totally unacceptable and must be addressed immediately. Number two, denial of cancer and NCD services. Many cancer and NCD patients have been denied care or forced to pay out of pocket for services previously covered under SHA. Despite government assurances of a seamless transition, numerous patients report being turned away from treatment centers, creating unnecessary financial and health burdens. And we have heard that even from the survivors who shared here. Number three, unclear SHA oncology and NCD coverage. There is a widespread lack of information on what SHA covers, leaving patients and healthcare providers in the dark. The absence of clear communication has led to confusion and service interruptions for critical treatments, including chemotherapy, radiotherapy, dialysis, and diabetes management. We demand immediate transparency regarding SHA's oncology and NCD coverage. Number four, system failures and delayed access to care. Technical issues with SHA's registration, the login, pre-authorization processes have caused significant delays in patient care. This has led to life-threatening interruptions in their treatment plans. SHA must urgently receive illnesses fund is woefully inadequate compared to the estimated required to meet the demand. The fund is supposed to take care of chronic illnesses when shift coverage is exhausted. Without sufficient funding, cancer and NCD patients will continue to face extreme financial hardships in accessing essential treatments when their shift coverage is exhausted. The same predicament is faced by the Primary Care Fund, which is supposed to finance cancer screening services for early detection. Number six, severe delays in radiotherapy treatment. Cancer patients awaiting radiotherapy at Kenyatta National Hospital are facing extreme delays, with some patients scheduled months after their diagnosis. The delays also affect patients seeking radiotherapy services at Kenyatta University Teaching, Referral, and Research Hospital. Such delays significantly compromise treatment effectiveness and result in disease progression. The government must optimize existing radiotherapy machines, establish regional radiotherapy centers, and engage private hospitals through public-private partnerships to ease the burden on KNH and also KU referral. Number seven, diagnosis delays. Despite the PET-CT scan being a critical diagnostic tool, patients at KU TRRH are waiting for long before getting an appointment for PET-CT scan, and their results also takes an equally long period. This is notwithstanding the fact that sometimes doctors urgently require these test results to proceed with treatment. This means delays in diagnosis and initiation of treatment that leads to disease progression and poor treatment outcomes. Number 8, premium repayments under NHIF not carried over to SHA. Repayments of premiums under the defunct NHIF should have been automatically transferred to SHA. However, there are cases of patients being told that facilities do not know about the patients having paid under NHIF, and they direct the patients to pay afresh under SHA for them to receive the treatment covered by SHA. Thank you, and I hand over.
The whole week watoto hawajakuona, boma hujaonekana, hujakula vizuri, hata tukiambiwa kula vizuri healthwise Kenya tunakula nini? So ni fair uko nayo kutoa kwa nyumba, kuona daktari 1100 na kurudi nyumbani. Then unaambiwa kula vizuri. Utakula nini vizuri? Na utakula nini kama hakuna pesa? So there is a lot of challenges tunapitia magumu. Tafadhali. Number 2, the mambo ya system. Kenyatta is a hospital kubwa. Tunabebananga number 5. Lazima ubebe kabagi kwa na file ya photocopy zako zote. Lazima ubebe, kama umefanya PET scan lazima ufanye photocopy. Kama umefanya hizo blood work lazima ufanye photocopy. Sababu lazima uwe na file yako na file yako ya Kenyatta. So unapata Kenyatta hawajaweka hizo records zako na unakuuliza zako ziko wapi. So lazima ubebe file yako ya hard copy. Na kuna mwingine hana hiyo akili ya kufikiria, anaweza fanya photocopy. So kama ipatikane Kenyatta una have to rudia. Tupatie PET scan tunafanyia kwa siku gani? Unafaa tupatie. So kama hawana itabidi tu ufanye utena. Na hiyo pesa ndio challenge ya kupata ufanyiwe photocopy tena. So kama ingekuwa system, ufanye kwa system. Ikikritu hapo Esther, kila kitu inaonekana umefanywa ABCD mpaka wakati fulani umefanya matibabu mpaka saa hii. Ingekuwa afadhali, ingekuwa rahisi kwa sisi.
Asante sana. Thank you so much for sharing your story.